Hello, my name is Judy Zelikoff, and I'm a professor in the Department of Environmental Medicine at NYU Grossman School of Medicine. And I'm here today to talk with you and to introduce our speaker, Lorna Thorpe, who's going to be discussing today about indoor air pollution and indoor health. And we hope that you enjoy this. Let me introduce Lorna for you. Lorna is, or Dr. Thorpe is a professor, and she's a director of the Division of Epidemiology at the same NYU School of Medicine. She's in the Department of Population Health, and she serves there as the vice chair for planning. She has a real handle on public health as well as academic life. She's worked with policymakers, regulators, all to bring about safe practices and protect the population. So she's currently leads a number of projects in the area from the federal government as well as the CDC, and you've heard a lot about them lately, and as well as other foundations that fund her research. She's engaged recently since COVID last year in March. She's recently engaged in a number of different COVID prevention initiatives. So I'd like to introduce Dr. Lorna Thorpe to you, and please stay tuned. And remember, this is about your questions. So please have questions and write them in the chat. Thank you.
Thank you, Judith. It's a real pleasure to be here. I wish I could see all of you. As you heard, my name is Lorna Thorpe, and what I'd like to talk about today is indoor air quality and how it affects our health. Let's start with a couple of things. First, we breathe about 35 gallons of air every day. It's a lot of air, and the air that we breathe is often indoors. We breathe air outdoors when we're outdoors and indoors when we're indoors. And so what I want to go through is a description of some of the issues with indoor air quality that can affect our health. And we're all familiar with this. We know when a room feels dusty. We know when we smell secondhand smoke coming in from another unit in our apartments. And we know when a home sounds moldy or smells moldy. And that's what I'd like to sort of walk us through. I'm going to have a particular focus on secondhand smoke because it's really one of the major contributors to indoor air quality. A lot of my work is around housing and health, and there's many ways that housing can affect the health. So the quality of air inside one's home is one way, but affordable housing and lack of affordable housing can affect one's health. Having unstable housing, being housing insecure or homeless at some points in one's life can affect one's health. And then the neighborhood attributes around where one lives and the air quality outdoors, the safety of a community, resources, the walkability of a community can all affect health. So housing and health is a really important area to do work when you're thinking about how to improve health by changing where we live and work and sleep and play. When we talk about indoor air quality, there are many different types of pollutants in the air that are common in the home. Some of them we deal with regularly. The one I mentioned earlier is secondhand smoke, and I'm going to come back to that. But other common concerns might be dust mites that gather in the home, or aerosolized chemicals from regular everyday I'm so sorry, what is the word that I'm looking for? But basically many things that we buy
consumer products,
I apologize, can have chemicals that actually can be released into the air, and they're often called volatile organic chemicals, VOCs, which basically mean they can be aerosolized fairly easily. Some homes have formaldehyde in the home. And the formaldehyde in the home can come from cigarette smoke, because there's actually formaldehyde in tobacco smoke, but it can also come from consumer products. And it depends on the bones of the house itself. So many of us here in New York City live in apartments. So how much ventilation do our apartments have? How new is the housing versus how old, and whether or not we can open windows or can have a big impact on the air quality. But it's interesting that for a long time, we really didn't know about the true impact of air quality on health. And that's where scientists like ourselves often perform studies. And one of the first really compelling studies was done back in the 1980s in Japan. And it was a study that looked at wives and the risk of cancer among women in households of male smokers and male non-smokers. And so they were looking over time at the risk of cancer in these households. What they found was women who smoked had the highest rates of lung cancer, clearly. But the group behind them were the wives of smokers had elevated cancer levels compared to the wives of non-smokers. And that was one very rigorously conducted study that began a pathway for the World Health Organization to name secondhand smoke as a carcinogen. And we know that now. Many studies have been done. Secondhand smoke has a big impact on the heart. It increases risk of coronary artery disease. It increases risk of cancer. And it increases risk of blood pressure. For children, there are many risks as well, and also stroke in adults. For children, it increases risk of asthma and asthma exacerbation. So if a child has asthma, their asthma can worsen. It can increase risk for middle ear infections. And even there are some concerns about neurodevelopment of children when they're exposed to a lot of secondhand smoke. For pregnant mothers, more health concerns. Children who are born to women who have a lot of exposure to secondhand smoke can be lower birth weight or have earlier gestational age. So that's very well documented now. We know that secondhand smoke, there is no safe levels of secondhand smoke. The next round of scientific studies that have been really helpful for us have been studies that actually measure how secondhand smoke moves in units in large buildings. So very careful studies that measure air quality indoors have been done to see when a cigarette is lit in, say, apartment 1D, on the first floor, what happens to apartment 1E across the hallway, or what happens to 2D or 2E, to see whether or not you can actually see a rise in the secondhand smoke and the nicotine and the particulate matter that go into the air when somebody smokes. And they show very clearly that, within a few minutes of somebody lighting a cigarette in one unit, you're getting not as much, clearly. So you might see a big spike in poor air quality in the home of the smoker, but you see a spike in the home of the non-smoker as well. And all of that has really led to a movement nationally, which is a good movement, but a challenging one, which is for homeowners, landlords, and government agencies to begin to ban cigarette smoking in large multi-unit housing. It's not a federal law for all multi-unit housing, nor is it a municipal law in most places. But in certain buildings, it is a federal law. Here in New York City, we have about nearly 500,000 people who live in public housing. And that's a very large population. That's the size of the city of Boston or Miami. And now across the country, all public housing agencies have a rule that they have banned smoking in the home. And it's tricky. It's tricky because it's it feels particularly unfair for public housing residents to be mandated to not smoke in their homes, whereas people living in the private sector can. And there are important issues there, social justice issues. At the same time, studies have overwhelmingly shown that most public housing residents, often in the 70%, 80%, sometimes 90%, would support a ban on smoking because they're living with the experiences of accumulated secondhand smoke, and it's affecting their lives or their children's lives. So it's a tricky issue, but this has been enacted, and it's hard to enforce. Many privately owned buildings here in New York City, the landlords have determined, or the building management has determined, to go smoke-free. So we have a lot of smoke-free buildings in New York City, and probably many of you on the call are saying, not my building, because we have many that have not. And so it's tricky what one can do when you have neighbors who are smoking. We can talk about that during the Q&A. But I just wanted to wrap up with a couple of thoughts. One is, we're doing a major study to say what happens when you ban smoking in public housing. What happens to the health of the residents? Are we seeing improvements in birth outcomes? Are we seeing fewer asthma attacks? Are we seeing improvements in the health of older residents, et cetera? And so that work is ongoing right now. I'm also beginning to work now with colleagues on what can we do about it. And so I just want to leave with some what can we do about it messages, and then we'll take some questions. First, if you have the ability to open windows, ventilation is the number one thing you can do. So fresh air is really important. If you have the ability to change air filters in air conditioning units, heating units, changing those and upgrading those to more recent filters has a big positive impact on air quality. And then more and more, we're learning that portable air filters, and you sometimes hear about them as air sanitizers or air filters. These portable air cleaners really can, they don't make your air perfect, but they can reduce the amount of impurities in the air. And that has been shown to have positive effects on health, including lowering blood pressure. So those are just some examples of steps individuals can take. Clearly, these policies to ban smoking indoors in multi-unit housing are a fairly forceful and positive way to reduce the amount of secondhand smoke that people living in densely urban settings can achieve. And so with that, I'll stop talking and see if I can answer any of your questions.
Okay, thank you very much, Dr. Thorpe. That was really informative. And I failed to mention when we opened up that this series called the Simple Science Snippets is being brought to you by the NYU Center for Investigational Injury and Environmental Hazards, CIEH, which is supported by the National Institute of Environmental Health Sciences. And so please put some questions in the chat for Dr. Thorpe. And while we're waiting for all of you to start typing, oh, I think I see something. Okay. Our community has many areas of where the soils have been impacted by legacy pollutants. How concerned should residents living near these legacy pollutants in the soil, how concerned should they be, and about the soil, the contaminants running further away from their house?
Yeah, well, maybe we can tag team this one, Judith, because this is more an area that you focus on than I do. But I think, first of all, the most important thing we can arm ourselves with is knowledge, right? So understanding what the levels of pollutants are in our community can tell us whether there's a real concern or not. And when we have actual information about pollutants in the soil, and if they are elevated, that information, those data, are powerful. When held in the hand of a community resident in front of policymakers, I think it's very powerful to say we have documented a problem here. So number one, know the problem and understand the problem. And then, remediation efforts really depend on the type of contaminants in the soil. So I think this can potentially be a major concern, depending on what the actual contaminants are.
Oh, I think you answered that perfectly. I have nothing to add. If you had to recommend air filters, what kind of air filters would you recommend? And what if people live near a highway, which many people do in New York and in the boroughs?
Yeah. Well, first, living near a highway can impact indoor and outdoor air quality. So it is challenging and sometimes challenging to move. So it's tricky. You want to open the windows because that's a great solution. But if you're near a highway, you're not, what you really want is to be able to open your windows to clean outdoor air. I think portable air cleaners have really improved a tremendous amount over the last 5 to 10 years. They're much more popular now. They're much more sophisticated and affordable, which is good. And I think now, it's a one-time investment that people need to make to purchase an air filter, and that can vary in price from $100 to $300 or $400 potentially, which is fairly expensive. But once you have that air filter, that portable air cleaner, the filters are not that expensive. And that's important because then you can keep going on over time and keep the air quality in your home. This might be particularly important if you have a child with really strong asthma or allergic to dust mites. The portable air filter can help. And as I mentioned earlier, it can help with blood pressure as well. I don't have a recommendation for a particular type brand, but I think, just a little bit of time doing homework on, I'm sure there are non-advertised reviews that you could take a look on online.
Thank you. So someone tells me from the chat, someone tells me I have mold in my house. Should I panic? What should I do?
Yeah, well, mold is a concern, and it is important to address. I mean, mostly mold causes irritation and discomfort. Those are the primary concerns. But there have been studies that suggest that they can have respiratory. So the irritation can cause respiratory symptoms, and I think that you don't want the mold situation to go unchecked. It's typically not a major killer like secondhand smoke. You can have some mold that gives off some of the volatile organic compounds, but I think mostly you want to avoid irritants, having respiratory irritation, and you want it to stop from worsening. And feel free to add anything, Judy.
No, you're absolutely right. The only thing I would add is to have some kind of environmental engineer or someone who could come and tell you the type of mold, because that matters. Mm-hmm. And some have no effects at all, like the ones that are on your white bread, but others can be more harmful. So definitely want to look into it. Another question, and did New York now legalize recreational marijuana? I lost track of where that was in the.
No, this is an interesting question. So I'm going to infer what the question is.
Okay.
Unless you have it right there and want to read it. But so marijuana, recreational marijuana has not been passed in the state of New York. It has undergone some decriminalization, and there is a potential for recreational marijuana to become legal in New York, the state of New York. And that has, all sorts of objective positives and negatives. But one challenge in the city of New York when we live in these large multi-unit housing is the smell of secondhand smoke, marijuana smoke. And so while we may have policies that reduce the smoking in our building of cigarettes, what about marijuana? And so many people are reporting smelling as much secondhand marijuana smoke as they smell secondhand cigarette smoke. There are not many studies that have really looked at what the health consequences are, and we do need more of them. And so I do think that this is an understudied area in terms of what it means for health, but we do know that it's very common exposure that many New Yorkers face.
Before we get to the next question, could you elaborate just a bit on what secondhand smoke actually is? And while you're talking about it, maybe you could say what third-hand smoke is and whether that's a problem indoors as well.
Sure. So secondhand smoke, and I apologize that I didn't walk you through this earlier. Secondhand smoke is if I am smoking, I am inhaling cigarette smoke and then releasing it when I release the puff after I take a drag. That puff of smoke that I release is secondhand smoke. So it's smoke that basically is in the air, that's passing from my area to an area where other people may be exposed to it. And we know whether people have been exposed to secondhand smoke in rigorous studies because we can actually draw a little blood and look and measure nicotine in the blood. And so we know that at any given time, a person is regularly getting exposed to secondhand smoke if their nicotine levels are high in their blood. The good news is that the number of Americans, non-smoking Americans, who are routinely exposed to secondhand smoke has come down a lot in the past couple of decades in the United States. So this is a bad exposure that's going down, and that's good. The bad news is most of the exposures, it's still a quarter of Americans, 25% of American adults have the nicotine measure in their blood to show that they've had recent exposure to secondhand smoke of a sizable amount. So, and most of that is at home. Third-hand smoke refers to if I take a puff from a cigarette and I release that smoke into the air, that smoke is filled with particulates, and those particulates have all sorts of composition, but it's a lot of different toxicants, and they filter down and they land invisibly sort of on many things, on our furniture, on our carpets, in our curtains, and it resides there, and it resides there for a lot longer than we would like. And they actually aerosolize a little bit over time, and so we can be impacted not only by the air within the minutes after a time someone has smoked, but for months and weeks and months afterwards. And even studies that have looked at an apartment of smokers who move out and the place gets cleaned, 6 months later, you can still find residue, third-hand smoke residue in that apartment.
Thank you. Yeah, as you said, the cigarette smoke, secondhand and all, may be going down, but now we're talking marijuana. So secondhand smoke for marijuana may be an up-and-coming problem. So a question, as the weather gets warmer during this COVID period, do you recommend keeping your windows open all the time?
I actually do. Generally speaking, fresh air is really good for all of us. I think it's good physically, as we've been talking about respiratory health. We've been talking about the ability to minimize the amount of particles. If you cook a lot in your home, you can raise the number of particles in the air. But if you open the window, you're not breathing those particles back in, and they're not getting trapped in your lungs. So opening the window reduces the amount of particles in the air, whether it's from smoking, whether it's from cooking, whether it's from a candle, whether it's from recently vacuuming. And clearly, if we're concerned about exposure to people, many New Yorkers live in multi-generational homes within relatively small spaces. So we have grandmas living with parents, living with children, and some people are going in and out and having exposures to other people in the community. When they come home, they can potentially put those household members at risk. So in addition to physical distancing and paying attention to that, opening the windows is a really good idea. I just talked to my sister in Colorado. Her teenage son just came, or her 20-year-old son just came home for a couple of days. She threw open all the windows just because she wasn't 100% sure how much her 20-year-old son was socially distancing.
So I have a question. I don't see any more. Oh, okay. A new question. Can you talk a little bit about vaping and secondhand exposure?
Yeah. So when one vapes, there is a lot less smoke that is emitted, tobacco smoke exposure that is emitted when one is vaping than when one is smoking a cigarette. So that amount that you're expelling is reduced in terms of nicotine and particles and the components that make up tobacco smoke exposure. But there still is nicotine and particulates emitted, and so there is a risk associated with vaping. I will say that risk is lower than the cigarette smoke.
For secondhand.
For secondhand.
We don't seem to have any other questions, and we're a little bit over time, but I am going to take the facilitator's right to ask you about children. So you brought it up a bit about multi-generational in apartments in New York City and other urban environments. What about children? Are they more susceptible to these indoor pollutants? What should we do if we have someone who's living in the house who smokes? Or we have our house being renovated from asbestos, or there's lead in the paint, in the wallpaper. What do we do with our children?
Well, it is true that children are more vulnerable to all of environmental risks around them. Their bodies are smaller. The exposure, an exposure to my body versus the exposure to a toddler, the impact on the toddler's body, the relative magnitude of what they get exposed to is bigger because their bodies are littler. They also touch things a lot more. They put their hands in their mouth probably a bit more than I do. And so, I think they tend to find ways to perhaps ingest or taste or smell these exposures a little bit more than adults do. And studies have shown that kids who live in the household of non-smokers, if you compare a kid who lives in a non-smoker in a detached home to a kid who lives in a house of a non-smoker in a multi-unit housing, the kids who live in multi-unit housing are getting exposed to more nicotine, even though they both live in a non-smoking home. So that's the blood test I was mentioning earlier. So, we know that children are more vulnerable, and therefore things like opening windows, things like keeping the homes relatively as clean as possible from consumer products that might have chemical toxicants that are aerosolized, and also just reducing the amount of secondhand smoke is really important.
So thank you. Are there any other questions? Seeing no, no. So seeing no questions, I'd like to thank Dr. Thorpe very much for a most insightful talk. And to remind you that I will ask Ms. Shah if she can tell you what our next snippet topic will be. Ms. Shah? Okay, thank you. She wrote it in the chat. So our next one will follow up on this in that there, as you heard, there are a lot of consumer products, including your clothes and your rugs and your furniture, as well as your household cleansers, that will can release into the air, into the indoor air, many toxic chemicals. So we're going to be talking about those particular toxic chemicals that are called volatile organic chemicals, and they come in different types and different forms. We'll be talking about that in our next Simple Science Snippets. So please join us then. We'll send the information for the Zoom. Again, thank you very much, Dr. Thorpe. And remember that it's YouTube, so it'll stay on for a very long time. So please tell your friends and your neighbors to please tune in and watch us. Okay, thank you very much.
Thank you.
Bye-bye. Rena?
Okay, yeah.